Imagine this scenario. A patient walks into the hospital, talking normally, using their phone, not looking sick at all. But when the doctor checks the pulse oximeter, his oxygen saturation is found to be 75%. Normally, at this level, a patient should be gasping for air, but the patient is calm, no breathlessness, no panic. Hello, myself Dr. Mukhi, presenting you with another mysterious and dangerous condition called silent hypoxia, also known as happy hypoxia. Today we'll discuss the definition of silent hypoxia, its pathophysiology, how to diagnose it, how to treat it, and how to prevent silent hypoxia. Stay with the video for complete understanding. Let's understand the definition of silent hypoxia. So, silent hypoxia is a clinical condition in which arterial oxygen saturation is dangerously low, but the patient does not feel shortness of breath or respiratory distress. What happens in most of the people when oxygen drops, the body triggers rapid breathing, also known as tachypnea. There will be air hunger, there will be anxiety. But in silent hypoxia, these warning signals are totally absent. And this makes the condition extremely dangerous because patient may delay seeking medical care. Let's understand the pathophysiology of silent hypoxia. To understand silent hypoxia, we must understand how the body normally detects low oxygen. So normally the body detects oxygen levels through chemoreceptors located in carotid bodies and brainstem. So when oxygen drops, these receptors triggers. Hence there will be increased respiratory rate and there will be feeling of breathlessness. What happens in silent hypoxia? So there are several mechanisms that are involved in silent hypoxia. One is like ventilation perfusion mismatch. In many lung diseases, especially like viral pneumonia, air reaches alveoli, but the blood flow is impaired, and this causes poor oxygen exchange. Another one is impaired hypoxia response. So some diseases reduce body's ability to sense hypoxia. The brain fails to trigger the sensation of dyspnea. Another one mechanism that is involved in silent hypoxia is preserved carbon dioxide removal. Breathlessness is often triggered by high carbon dioxide levels, but not low oxygen. So in silent hypoxia, carbon dioxide remains normal, so the brain does not trigger air hunger. The fourth one mechanism is microvascular injury. So damage to pulmonary microvascular causes shunting of blood that reduce oxygen transfer. So let's talk about the clinical features of silent hypoxia. So patients may appear surprisingly comfortable, and common findings include like there will be low oxygen saturation, often below 90%. There will be mild or even no breathlessness. There may be mild cough. The patient may have fatigue. There will be slight tachypnea, but severe symptoms may suddenly develop, which includes confusion, cyanosis, and respiratory failure. How will you diagnose a case of silent hypoxia or happy hypoxia? So diagnosis is mainly based on objective oxygen measurement. First one is pulse oximetry, the most important tool. The normal oxygen saturation should be in between 95 to 100% in a healthy adult. And silent hypoxia patients may show oxygen saturation level in between 70 to 90% without any symptoms. And second one is arterial blood gas analysis that confirms hypoxemia. Then in ABG we can find there will be low partial pressure of oxygen PaO2, and there will be normal or low partial pressure of carbon dioxide PaCO2. And third one is the most important is chest imaging. So chest X-ray or CT SSG thorax can show pneumonia, ground glass opacities, or lung inflammation. And the fourth one is clinical monitoring. The important parameters include respiratory rate to rule out tachypnea, then oxygen saturation, and the mental status of the patient. Now, how will you treat a patient who is having silent hypoxia? Treatment always focuses on restoring oxygen level and treating the underlying causes. First, we have to give oxygen therapy. This is the first line of treatment. And the methods include nasal cannula, face masks, or high flow nasal oxygen. And second one is like awake proning. Lying in the prone position improves oxygenation by recruiting posterior lung segments, improving ventilation perfusion matching. And third one, treat the underlying disease in examples like viral pneumonia. If you suspect of viral pneumonia, start antiviral therapy. And if you suspect of bacterial infection, immediately start antibiotics. And if you suspect of pulmonary embolism, start anticoagulation therapy. And fourth one is non-invasive ventilation, NIV. If oxygen therapy is insufficient, better to go on CPAP or BiPAP. And fifth one is mechanical ventilation. In severe cases, where respiratory failure is there, we have to start with mechanical ventilation. Let's talk about the complications of uh, silent hypoxia or happy hypoxia. So, if untreated, the silent hypoxia can lead to acute respiratory distress syndrome (ARDS), and that will lead to multi-organ failure. And third one is cardiac arrest, and fourth one is death. So, how will you prevent silent hypoxia? Prevention mainly involves early detection, home pulse oximeter monitoring, especially for respiratory infections and high-risk patients. Early medical evaluation. Seek care if oxygen saturation is below 94%, if there is persistent cough, if there is fever and fatigue. Third one is respiratory infection control. Go for vaccination, use mask in outbreaks, and early treatment. Silent hypoxia is dangerous because your oxygen can fall to life-threatening levels, while you still feel completely normal. This is why monitoring oxygen saturation can sometimes save lives. Remember, your lungs may stay silent, but the oxygen monitor never lies. If you want more ICU medicine, explained simply, subscribe and follow for the next episode. Thank you.